Today's subject is side effect of blood pressure medicine. I mentioned one more time that let's say 30 years ago, 30 to 40 years ago, age 30 plus 90, 120, that was normal, 120. But when you become, 60 years old, then supposed to be 150 must be, right number. Now, if we lower from 150 to 120 with medicine, then when I was 30 years old, I didn't have, gray hair, wrinkle, or, bad eye vision, things like that. So when I take it, so I took it 120 with medicine. So can I change my gray hair to black, or wrinkle, or vision improve? Nothing happened. It's just a number, okay? So, however, we have to prevent the stroke. Now, if I get the stroke or anyone get the stroke, it's not only for myself, but affect so many people around, including family. So we have to prevent. But in order to achieve prevention, we have to look at history a little bit. In the past, that a stroke must be happen inside the brain, and at the time it was hemorrhage, cerebral hemorrhage. Now, so the hemorrhage here is blood vessel, okay. Blood pass through, and here is a bleeding over here. Could sometimes it go in here, and obviously bleeding can be happen here. However, this one, because pressure must be high, so they are interested in lowering blood pressure. And I don't know when exactly, while I'm watching TV, some kind of debate between, Western doctors. And one of the questions was, do you take blood pressure pill? And some said yes. And some other groups said no. So, wait a second, this is the interesting answer. So I turned a volume higher, and I listened carefully. And this doctor who said, no, I don't take it, he is specialist of stroke. Oh, so I listen carefully. And so when patient come to him, he ask patient, did you take blood pressure pill? And many patients answer, yes, I never miss. But they got a stroke. So according to him, taking blood pressure pill to prevent stroke, and they still get the stroke. So why should I take it? It makes sense now. Now, there was, maybe 25, 30 years ago story. And then in the meantime, there are different kinds of stroke. One is cerebral infarction, and second one is cerebral hemorrhage. So I ask a question medical doctor, and I search, I search the all kind of essay, things like that. What I want to find out is this. Let's say here is 1980 and 1990, and here is 2000 and 2010, and here is 2020. Now, we can guess here is the infection, and here is hemorrhage. Now, we can guess, okay, maybe this is a 50%, this is a 50%, or this one may be 70%, this is a 30%, based upon the stroke. Maybe this is 80%, this is a 20%. By asking many people, nobody can answer, which ratio. But I am not able to study all those kind of things. I'm not that person, okay? So just to forget about my research or my study. I just just to look at the number. Now, these days is hemorrhage is 10 to 15%, and the infection is 85 to 90%. Now, we don't know this number, this ratio, but now we know that infection is almost 90%, and hemorrhage is about 10%. Probably from here we take a blood pressure pill, but nobody knows what's going on. Then gradually we found out that one of the reasons of stroke is by infection. Not only hemorrhage, but with infection too. So now, from around 2005, there is called 7-point T MRI. Okay, so now MRI existed before 2005. But it was not accurate. So even though they look at it, they are not able to distinguish this. It's not clear picture. But now, since 2005, that we can say, oh, this is by infection. Oh, this is by hemorrhage. Not only that, now they found out also MRA. They put kind of dye. Then they can see all the blood vessel in the movement now. So therefore, in my opinion, since we invent MRI, then we found one of the cause is infection. So now, I'm not so sure whether I am doing right in theory or not, but I'm pretty sure I'm right in my opinion. Now, I mentioned also that there is what do you call that? side effect of blood pressure pill is kidney dialysis. But that's only one? I don't think so. Let me explain my idea, okay? Let's say here is blood, and here is, let's say this is okay. Go to here. This is a vein. This is the artery, okay? Artery. Now, when this blood pressure is 150, then obviously over here, there is some kind of residue over here. So 150, then it can go to pass through here. But if this is 120, then it cannot reach over here. Can be reached only up to here. Then start blocked and accumulated. It's possible, right? So if 150, I can pass through here, but because of 120, I cannot pass through. So if the blood cannot come to the brain and go down, then what happened? Sometimes I make memory loss, and sometimes I have a headache. Sometimes even though creating Alzheimer's disease, dementia. Not only infarction, but also all other kinds of symptoms can be created because of this blood pressure pill. Let me go further. Okay, this is the pancreas. If I got the high blood pressure 150, yes, I can pass through, but because of 120, I cannot pass through, creating diabetes. Do you think it's not possible? Now, when my blood pressure 150, go all the way to the at the end of the finger, but could come over here and stop in here. Then what? I have a numbness in the finger and the toes, and I have a pain, rheumatism, arthritis. Hey, I want to prevent high blood pressure. But what about this side effect? Who is responsible for this side effect? So, however, we have to find out cause and try to solve a structure. Okay? So one by one. Thank you so much for your watching.